Good evening to all of us. You are most welcome. It's yet another opportunity that we have to raise awareness on autism. We want to thank every last one of you for taking your time to come and learn with us, engage with us. And I'm sure today you will really enjoy this session. With us, we have our wonderful facilitators and panelists. We have Dr. Ndurumo Stephen, who is a veterinarian and working dog specialist. And also we have been joined by Amira, and she's also the founder, East African Kennel Club, member of Labrador Retriever Club of Kenya, and the Ladies Kennel Association, and she's as well a dog trainer. And so today we want to talk about matters to do with animal-assisted therapy. And when it comes to autism, what is this, in short, AAT? I know for many of us, it's a new thing. I've actually encountered caregivers telling me to elaborate on this, and they were looking forward to hearing from the experts, because it's not very common in many Kenyan homes, but we are humbled and privileged to be bringing this right to you when you get to watch this. So karibu sana, Dr. Ndurumo and Emmy, karibu sana. We are looking forward to hearing from you. Now, to start us off, we're going to start with a word of prayer, as we always do. And then I will share a clip on autism, just trying to let us know what is autism. Maybe this is your first time interacting with the word autism and the condition. What are the signs? What are the symptoms? And so that now will build up to a discussion for the day. And so I want to invite Lillian to just begin with us with a word of prayer, and then I'll take it up from there. Lillian, karibu.
Thank you, Caroline. And let us pray. Father in Almighty God, Father, we want to thank you for the day of today. We want to thank you for yet another opportunity to come and learn more about autism and animal therapy. Father, we commit this webinar to you, and at the end of it, we shall thank you and glorify your name, and let all honor shall be back to you. In the mighty name of Jesus Christ, we pray.
Amen.
Amen. Amen. Thank you so much, Lillian. And so just as I've said, I'm going to share my screen, and it's going to be a short clip on what autism is. And then from there, we will pick it up. So I'll share my screen just right away.
Hi, my name is Dr. Naida Torres Soto, and I am a speech and language pathologist here at Nicholas Children's Hospital. Autism, or autism spectrum disorder, is a developmental disorder that affects communication, social interaction, and behavior. It typically appears in early childhood, and parents and caregivers may notice signs and symptoms as early as 12 to 18 months of age. If you're
No. Call Julia in front of me now. Let them put Yura back to work. Wait a minute. Have you completely lost your mind? Call him. All right then. Just calm down.
Okay. I hope we have all gotten the chance to now learn a little bit of what autism is. And just to also bring in a little bit of background, I'd like to also share one more clip on animal-assisted therapy, just to bring in a little bit of a background. So I hope you will also enjoy the next clip. So. Okay.
Do you know that petting a cat can actually reduce high blood pressure? That riding a horse has been shown to improve strength, flexibility, and or that a recent study found interacting with dogs can reduce the need for pain medication by as much as 50% in people recovering from surgery. The stress hormone cortisol has been linked with a number of diseases and disorders and has been shown to decrease through animal-assisted therapy. At the same time, beneficial hormone levels like oxytocin and dopamine increase. In fact, therapy animals have been shown time and time again to promote and improve good health in people facing a whole host of challenges. From autistic children to seniors residing in nursing homes, people respond to animal-assisted therapy on not only an emotional level, but in physical ways. Spending time with animals, whether horses, dogs, cats, birds, or guinea pigs, is a valuable addition to other treatment approaches. Animals improve motivation and happiness and reduce feelings of loneliness and stress. Animal-assisted therapy can be a valuable tool for boosting health and quality of life in people of all ages. To learn more about animal-assisted therapy, visit the Information Center at carrierclinic.org.
All right, so I'll stop sharing there. And I believe it's given us just a brief background, but we will learn more from our experts today. And at this juncture, I want to invite Dr. Ndurumo. Once again, Dr. Ndurumo is a veterinarian and working dog specialist. So Dr. Karibu, and just tell us a little bit about yourself and definition of animal-assisted therapy. Then we pick it up from there.
I'm Dr. Ndurumo Steven, like you heard from Caro, and I have a background in both clinical veterinary medicine and working dog management. For about 6 years after graduation, I worked with clinical practice, and another 10 years I did work with working dogs. That is both protection dogs and detection dogs. A bit of animals helping people who are in some difficult situations came in, but that was not directly animal-assisted therapy, but it was in a way, because I got a chance to work with people in Afghanistan with the bomb detection dogs, and some of the people who are on leave or rest and relaxation would like to come and pet our bomb detection dogs, which are very docile and sociable. So that's the first place I saw where people are very far from home in a war zone, where they want to come and just spend time with a dog, and they are not dog handlers. So I think my small background is that I did that, and I've just gone back to practice, although I retired, and I just want to raise a family. Now at 2, but here we are. Now, by definition, animal-assisted therapy is anywhere where anybody or a therapist or a professional uses animals in a rehabilitation procedure or intervention, whatever intervention, using a trained animal. Now, this animal is used, of course, with other treatment modalities to assist with the difficult situations. The difficult situations could be, like I said, post-traumatic stress syndrome. It could be mental health problems in adults, children, and adolescents, or indeed conditions like we've just seen in the autism spectrum syndrome, which are neurodevelopmental disorders in that sense, which will also include in this sense attention deficit and hyperactivity. Others variously would be attachment disorders, self-harm and suicidal behavior. Related or not related to this could be isolation. People who tend to isolate themselves, have low esteem, have issues with dominance or submission. They're too submissive and such also fall into this. The most commonly used animals are the dogs and horses, and we'll see a bit about that as we go down. But the basic, the fundamental background of using this is because, to start with, an animal is a sentient being. That is to say, even if they don't talk back to us through whichever other modalities they have to communicate back to us, we know they have feelings. They have feelings, and they also like to form a social bond, coming from their natural background and coming to when, for example, the dog was domesticated by humans for companionship, for hunting, to help them work, to help them feed themselves, to protect them. And for example, horses were also domesticated by man to help with transportation and also just keeping them company and protection in a way, because they could carry them into and out of war fast. Now, where we have a congruence, where we have a meeting point for these two species, is where we utilize and take advantage of that interaction to apply animals to change or to potentiate, like we say, other therapies when you are dealing with the conditions that I've just mentioned, in trying to alleviate or to make that patient better. Some of the times you alleviate and people probably they forget if the adult onset issues or social caused by social interactions. You can have isolation, submissiveness, low esteem and such. You can have depression because somebody has lost a job, and I've had somebody come and bring their cat, which was straight to me and said, whatever you do, doctor, you have to do to this cat, because when I didn't have a job for a whole year, in my house, my family left, everybody left, and only this cat came and kept me company for a whole year. And whatever interaction that person had, even without a therapist, in the interaction is proof enough to what animals can do to human beings and their mental well-being. Now, in the space of neurodevelopmental disorders, especially in children, autism, that we are focusing on today, we have physical and mental issues that come with autism that animals will help. Now, if a child is going to the point where they are happy when they see, their eyes light up when they see a dog or a cat, there's something that goes on in their mind that we don't even know. But the moment now that connection is there, for example, when they see a pet, somebody's pet for the first time, or an animal assisted therapy, a dog or a horse comes into the ward or their home, or they go to them, that is a click that you're looking for. So the moment you get to that point, you're starting to develop this child in terms of social interactions, because they might want to find out from the animal itself, even if not from the handler, their name. Okay, then you see the kind of energy that they have, the positive energy. They are more susceptible to taking in what a therapist, their own therapist, will tell them to do or present to them. It makes the work of a therapist easier. Going forward, the more this child or person or patient picks from the animal, wanting to spend more time, you can graduate to giving them the chance to pet the animal. Then you start to develop that urge to do something physical, that they can reach out. You're improving the sensory input, motor activity, and all that. So if you're going to have some time with this animal, be it a horse or a dog or a parrot or a cat, this person is going to have stages of developing themselves, which the therapist or the doctor will be very happy to see if they are improving their motor skills, if they are improving the interaction with the people around them, the animals, and generally scoring a higher aptitude as they go along. If then it gives them also a motivation to get up and do something, to give a treat or to give a command and be very happy when the dog does something, then you find that if it is the eye contact that we have just seen, either don't follow you, autistic children will basically have, so to speak, is apathy. They're not like, they don't follow the event in their environment. But if you have this person wanting to follow their eyes because there's something interesting, like an animal, that is a good start, because they are able to now improve on that aspect of the eye improvement. Social interactions, physical movement with their hands, and motor skills, building up their muscles, getting endorphins produced in their bodies. All those is what we aim with an animal. Now, the shape and form of this animal therapy, animals or birds, or it could be even a reptile, but the shape now is what we'll get into to see. Probably the most common is the dog, for the reasons that we'll see later in this discussion. But what is most important in my view, I am more biased toward dogs because I've worked with them most of my life, but be it any animal that will bring out this from somebody we're trying to improve from a difficult situation, I think qualifies to be a therapy animal, and then will fit into the definition that we're going to use any animal trained. Some of them are not even trained, but they have good temperament, they have been around people for so long. They have that bond that they can't speak and tell us that, yes, I've seen this person is a special needs person. I need to be very patient with them, but I've seen it happen with people who, for example, dogs and cats, they're very impatient with the grown-ups, but when they get to a child, they have some patience, they have some room they give them to be themselves. So any animal that has that attribute, one, two, a situation where you present that animal to somebody who is suffering from many of these afflictions of adulthood or being born with them, developmental disorders, then would be falling under this definition of animal-assisted therapy. I hope that suffices for now.
Yes, thank you so much, Dr. I think it has really given us a thorough understanding of what animal-assisted therapy is. And I want to bring in Ami at this point. Ami, you can tell us a little bit about yourself, and then you've been working with dogs, and you're a trainer, and you're the founder. I'm just reading something here. Founder of East African Kennel Club, member of Labrador Retriever Club of Kenya and the Ladies Kennel Association, and a dog trainer. Maybe you can tell us a little bit more about your interaction with dogs that provide therapy for children with autism or even adults with autism. How has that been for you?
So the first thing I want to do is correct you and say that I'm not the founder of East Africa Kennel Club. Even me, I'm not that old. I'm actually the founder of TNR Trust, which is Trap, Neuter, Release. And we do free rabies vaccination and sterilization in rural and low-income areas to prevent rabies. The first thing I want to talk about, yes, I am a dog trainer. I've been training for 18 years in Kenya. I've trained in the US for many years. The first thing I want to talk about is you're talking about animal-assisted therapy dogs or cats or companions. So in Kenya, we don't have any official designation or rules for allowing these different types of dogs here. So, and just in order to get your definitions understood, there's a service dog. The abbreviation is SD. And a service dog is a dog that's trained to do a specific task. So that service dog could alert someone to a potential seizure or low blood sugar. They could be trained to brace, meaning if a person falls down, the person, when they're getting up, they could push and brace so the person can stand again. The dog might be trained to lie down on the person, like if a person has high blood sugar and they're going to pass out, they may lay down, and the dog might be trained to lay across them or to go and seek help for them. So that's a service dog. We don't, as far as I'm aware, have any registered service dogs in Kenya. There's also an ESD, an emotional support dog. And that's probably closer to what you're talking about using for animal-assisted therapy. An emotional support dog is not trained to do any particular task. It just provides comfort to a human. It could be a child, it could be an adult. Frequently, those people have anxiety or PTSD, things like that. You know, Kenya, this is all very new. This is why I'm bringing up these different categories, because people frequently ask me, oh, can you write a letter and say that I've got a service dog so I can take them to restaurants and grocery stores and take them on the airplane? It doesn't work like that. It's not regulated in Kenya. In fact, even dog training is not regulated. So these dogs have different designations and they're trained to do different things. So an animal-assisted therapy would be an animal that's specially socialized to be with the type of person that's getting the therapy, meaning there's someone elderly, someone autistic, someone who is nonverbal, someone who may lack fine motor skills, so they may not be able to pet a dog. It might be that they're very, clumsy. So those dogs are socialized or habituated to the environment where they're going to be working. So it might be that they work in an old person's home, might be that they work with autistic children. So those dogs, again, have to be habituated to be very calm and to put up with certain things. So it could be that the child, in a case of autism, autistic child, it could be that, Dr. Tari mentioned, children who are nonverbal or children who don't make eye contact. It could be the child will be giving cues to the dog to do certain behaviors, like to sit or lie down or to do a trick. And then, of course, the child gets the feedback from the dog, and now they're doing interaction. So these are all different situations. And I don't know in your case whether you're looking for people to acquire their own dogs, or you're wanting to put together a pool of these dogs who can assist in this kind of therapy. What's your kind of idea on this?
Okay, first is thank you for what you've said. As you rightly put it, in Kenya, this is it's fairly new to most of us. So we start from the point of creating awareness that this actually exists. Even if it's not here in Kenya, it's somewhere in the world, but there is something we can do about it. So for now, we're creating awareness, then we'll build up from there as we move along.
Okay. So if you were going to look for a dog to become an emotional support dog or to be used in animal-assisted therapy, the dog's temperament and what they've been exposed to already, you would want a calm dog who doesn't get nervous, a dog who's good with people. You would probably, the appearance of the dog may be important. A lot of Kenyans are frightened of dogs. So if you go into therapy with, a Boerboel or a Rottweiler, it may not be very welcomed. It might be that you would look for something that, actually our Kenyan Shepherds would be brilliant at this, but something that has more, of a less fearsome appearance. Again, size would also matter, because if you are trying to care for, a giant dog like a Saint Bernard, it can be very expensive. And also, if the children are very small, they might be very intimidated by a dog that could possibly be, taller than they are. The dogs would have to be, if they're visiting, places where the children, like hospitals or schools, the dogs would have to be kept clean. The dogs would have to be, of course, vaccinated so that they don't spread any infectious zoonotic diseases. And also, if the dogs are going to become owned by families, the parents will have to understand that really they will be responsible for doing all the work. It doesn't matter what the goal is for the child to feed the dog or to walk the dog or to pick up the yard after the dog has done a poo there. It really will be the parents that are responsible. And these dogs would have to be treated like family members. You couldn't have a dog like this and expect it to be your child's, assistance dog, and yet you keep it locked on the veranda or locked in a box, overnight, etc. It would really have to be known that it would be part of the family for that to be effective. I think one of the things that would be most important when selecting a dog would be the connection, or like Dr. mentioned, the affinity that the animal and the child have for each other. Sometimes you can see a connection, very quickly, and other times it develops, but you would certainly want an animal that seems to like the affection with the child. The other thing that would be important is, if people are going to have these animals on their own, is there's no protection. If you have an absolute service dog in most countries of the world, if they're truly a service dog, not a fake service dog, you can take them into places on the plane with you. You're guaranteed to have housing for them. But in Kenya, there's no protection like that, which means, a dog used in therapy would have to, you'd have to make sure you had permission. If they were renting a flat or renting a house, it wouldn't be guaranteed that they could live in housing. There's no special protection here for these sort of animals. Maybe it'll come.
Yes, yes. We hear you. We hear you. Thank you. Thank you for that. I think that's quite elaborate, and I invite our participants, please, if you have questions along the way, just drop them in the chat section. Thank you for that, Amy. So I want to come back to Daktari on now in depth. I know there's some things you prepared for us as well. So you can tell us when, for instance, we are looking for these, when a caregiver is out looking for an animal that can be used in animal-assisted therapy, there are certain red flags that one should look out for. What are some of those red flags?
Thank you for the chance again. We have red flags, just like I'll talk about these red flags in the complete picture of the handler, the dog, the certification, and of course what the claim that would be for. Now, this claim must be bolstered, or must be supported by certification, what we call objective certification, where some third party will come and say, I have seen this dog work, and these are the set criteria that this dog and handler must meet. So most of the red flags will again entail, as pertains any profession or any claim for any business or trade or intervention you have there that people have to do and pay for money, for example. Now, as people who have actually worked with the animals, we know, like in this country, we have a huge challenge, because we have everybody who, sorry to say this, anybody who doesn't have gainful employment, anybody can get a dog. Then they become dog breeders, they become dog trainers, they become everything and anything. So soon you'll get somebody saying, I have a dog that can heal or cure your child of, or your spouse of this depression and all that. But the red flags would be just like for anything. If you're going to buy a car, make sure that the car is rightly registered. The car is owned by the party who is saying they own the car before they sell it. So the same thing. Now, the red flags that you look out for is lack of, how do I say, is vagueness. When you talk to a professional, and it's not to blow my own trumpet, but I'll blow Amy Rapp's trumpet. If you hear her talk about dogs, you don't have to ask for her credentials. They speak for themselves. So if you ever go and meet somebody, maybe you have a chance meeting, maybe the neighbor has a dog or a cat that comes in, or you're walking on the road or in a hospital and somebody says, oh, I have a dog or a cat or a house that actually does this kind of therapy. There's always that gut feeling that this is not right. So, but the best thing to ask, so that you can already see the red flags rising or being left standing, is, do you have any certification? Where were you trained? And for the handler, where are you trained and where were you certified? Then for the animal, same questions. Where is the animal from? What are the kind of temperamental checklists that the animal has to pass through to say, like Amy says, in an environment where somebody might have sudden jerking movements. Some dogs will bite, a horse will kick. Now, these animals that are actually amenable to animal therapy are very, very stable. Yeah, we call them, there's a term we use in canine training, when they have a very stable temperament and mannerism, calm, they have a calm air about them. Those are the kind of things that somebody should be showing through, and you're able to see. Now, if again you're seeing somebody who's come to you for that with a muzzle, a dog that has been muzzled, or a horse that is not very well taken care of. We see so many of that in our country now, but those are obvious red flags. They're not professional, they're straight out. Now, they're attending therapists because, of course, if you're going to do animal assisted therapy, there must be the primary therapist and most probably a doctor. And the parents to this person or relatives and people who depend on them and who talk into this. Now, if the therapist again is in sync or is in agreement with the guardian of the patient or the relative of the patient, and to the opinion of the doctor to say, yes, this case or this patient is amenable to animal assisted therapy, or maybe they are not, but you want to see if they are. Now, there are those bits and pieces that this animal therapist, the handler, let's just call them the handler before we go to the animal, because the animal is usually secondary to the human being handling them. You're supposed to have some basic background information about what the basics of emotional health, psychological makeup, mental makeup, physical makeup for humans, and the developmental growth even for animals. And we do this in veterinary school. There's a whole aspect of animal behavior that you do, for which I'll not go. The details are not necessary this forum, but there are those small bits that if I was to assess somebody who should know anything about a therapy dog or horse, I would ask. And that is important because anybody who knows even the bare minimum of ethology, that is animal behavior, then they would have a bit of sure footing when you come to use that animal to alleviate a difficult situation in somebody who needs it, a human being. Now, you must always remember the red flags is where are you based? Because if you ask somebody where is the dog from, where is the horse from, they must be able to say, for example, and it doesn't matter which estate or geographical location where somebody lives. You'll find somebody living in the up market. I don't believe in descriptions, but for the sake of argument, in the up market estates, and they keep their dogs. They have multi-million-dollar houses, but they keep their dogs in small wooden boxes. So if you're ever going to say, oh, I thought this is a good case, or rather a good dog for therapy because it came from, I won't mention the names of these estates, it comes from this estate because it's upmarket and is not from the other side of the compass. If somebody comes fronting saying that this dog has come from an upmarket estate, already that's a red flag. Now, if somebody again doesn't want to tell you where the dog is kennelled, where the dog has come from, where the family of the dog is, that's another red flag. If somebody doesn't want also to show, because if somebody comes to you as an animal therapist, they must come with the animal. At least the animal must be available for you to assess or to actually see. Same way, if somebody's selling a car, they must have the physical car, the actual machine, and a logbook, for example, and allow you to get your mechanic if you're not one to do a test on that car. So one of the easiest tests is the temperament of such an animal. Is this animal, how is the animal behaving when you're already asking the person questions? Because you who is going to solicit for this service from this person, we are assuming you're not the person who actually needs the therapy. You're actually looking as a third party for your son, for your daughter, for your relative, or you're a doctor for your patients. If then the interaction of that at the initial moment is dodgy, already that's a red flag. Because with animals, like we always say, animals don't judge, animals don't hide. If they are unhappy, they will show it. If they're happy, they'll show it. If then they don't think you're because they can pick up on cues better than human beings. A dog will change their body language or bark or bite. So if at that initial contact, then there is negative behavior, the dog or the parrot or the cat, that's a red flag already. There could be a whole list of them, but as long as people understand the basics of animals that are to be used or that are amenable to animal therapy, assisted animal therapy, then the red flags, some of them, you would pick them because it would be much easier to deal with the case at hand than to generalize. It's like people who tell you, I am a breeder, and then you say, oh, what dogs do you breed? And you say, Labrador retrievers, for the sake of argument. And then you say, oh, no, I wanted a Yorkshire Terrier. this person quickly jumps and says, oh, we also breed those ones. And you say, oh, in fact, my daughter wanted a Maltese Terrier. Say, hata hizo tuko nazo, even those ones we have. Another red flag, because we get a lot of that. People come to us vets with pets that they have bought or that they have inherited, and they say the paperwork reads a different thing, and it is signed off by a breeder. There's signatures and everything, but there are some red flags that are basic to our day-to-day lives when you're dealing with anything, be it well, a spouse, be it a car, be it a house you want to buy, be it anything. So the same thing that will apply to dogs, like I said, is case by case, but there's a broader classifications where somebody pretends to be a jack of all trades and they can provide you with any type of dog that you want. So if somebody, and then there is always this issue as somebody asks about therapy dogs or animals, you'll never find a kennel of 10 or 20 of them. Maybe this is different in the first world, but Amy can attest to this. Maybe I'm wrong. Maybe in the first world they are there, but you will not find specialist animals living 50 or 30 or 40 or 50 or 100 in one kennel, because they're special animals. So you'll find they have usually an odd number, 7, 13, on different breeds. But when somebody tells you I have a kennel that has 30 of these animals for therapy, that's already a big red flag, because everybody will say, oh, if it's a Pro Box you want, I have 20 of them in my yard in Mombasa. Similarly, that's a red flag. Now, the biggest handicap to us in this part of the world is, like Amy attested to, is lack of certification and regulation in the field of animals. Be it, as a veterinarian, I can list a whole list of almost 9 or 10 fields, but for the sake of this meeting, I'll call them working dogs, because therapy dogs are essentially a branch of working dogs in a way. So where we are right now with the government and any regulation is trying to extrapolate what the West have, to have regulation and to have certifying bodies, independent certifying bodies. Where we are right now is the general purpose dogs, the dogs that you see in the security companies used for protection. Some of them call them attack, but it's a wrong term to use for a dog, but it is what it is. But we are starting with the working dogs in the space of general purpose dogs, the dogs that are going out to protect the handlers they work, because we always say the dog doesn't raise the alarm, it is the handler who should raise the alarm. The dog should protect the handler to raise the alarm. So general purpose, not attack. We don't train these dogs to attack. So if you ever find somebody training a dog to attack, in that space is another red flag, but I digress. Now, the government input and regulation is important. Currently, we don't have any for therapy dogs, and by and large, this would come from the private sector or charities, so to speak. Now, your charity, I did a bit of background reading when you sent us the invite, would be a nice place to start, because you might find some, if you found a drug that works very well for a condition that a member of your family or your patient is suffering from, you can go to any length to do that. So it's a charity like yours and patients that you have through your therapy programs, that you get a dog or two or a horse, I don't know, to import and have somebody trained, because that's when we started about using explosive detection dogs in Kenya. We would get the dogs trained elsewhere, they come here, then they train our handlers to use the explosive detection dogs in country. So probably if we start to go and grow that space of therapy dogs the right way, with the certification and the right training for the dog and handler, that would be a nice place to start, because we are always trying to fit into the standards of people who've done this for many years before us, which is like it or not the first world. So the red flags, I can't really put my finger on them, but out of just basic common sense and just a bit of background information on animal, how you treat animals, how somebody treat an animal, I think that's a nice place to start. So if an animal is not well treated, if they don't treat that animal well, how is that animal going to work to help an autistic child or adult? So if there could be questions, then I can answer a specific question. Otherwise, I'll just keep zigzagging on this matter of the red flags. It can be many. I hope that helps anyway.
Yeah, that helps, even as I bring in Amy. Thank you for that, Daktari. I'm sure that was quite insightful, because that we have a lot. In fact, even when we were doing in our last month's topic on animal assisted therapy, that was very common. You know, when you're doing the research, we have this number of dogs. You know, we provide these, but you have helped us to shed light on this matter. So, Amy, just to bring you in on this, are there other red flags that probably we may need to look out for?
Well, I think that, you know, if you go to look at an animal and they're not in good shape, if they're dirty or if they're just freshly washed, it probably means that they were dirty and they're being washed just to be shown to you. Where they're being kept, as Dr. said, you know, you want to make sure that they've been kept in a good environment. You'd want to make sure that their vaccinations are up to date. And I think that, so we're talking about buying therapy dogs from abroad, or, you know, assisted therapy dogs. I would think that you could actually, if you were careful and took your time, you could start with actually adopting some dogs or cats, or maybe even horses or ponies or donkeys for this purpose, probably through KSPCA or even TNR, because KSPCA and TNR both have a very good system of matching candidates before they get adopted. There would also be a possibility to sort of try before you adopt. So, you know, you could see if the animal works out. I think it would be really fabulous if you could, you know, bring in dogs that were already trained to a very high level. I keep saying dogs, that's what I do the work with, but I think that it would cost an awful lot of money and you'd have to have some really good connections, because as we find even with the dog world, people import these expensive dogs that are supposed to be, you know, superior to everything we have in Kenya, and we get them here and we find that we've been sold, you know, the duds that no one else wanted. So I think it would be possible to, you know, adopt some animals and try to start from there. Have you guys ever done anything with RDA, with Writing for the Disabled?
Not directly, but we've tried reaching out to them. They were also supposed to be here, but they did not make it. It did not work out. Yeah.
Okay. I can't think of the woman's name, but when I first came to Kenya, I did some work with them just as a volunteer because it was fun and I could do it on the way home from the kennel club. It was good fun. But I mean, they certainly would have some, I use the term bomb proof, you know, some very stable horses that you could sort of try with. And maybe you would just start by visiting, you know, some dogs that were already pre-selected or some cats for the children to visit with before you make such a big commitment of purchasing them. I mean, Dr. can attest to how much it takes to do the vetting of a dog and feeding a dog and ongoing vet care. So I think it might be a better idea to start with trying with some dogs that are here from a stable background before you think about trying to import dogs. It's very expensive, and you might not actually get what you want.
Yeah, we hear you. We hear you. You know, I'm smiling because for many families, this is out of reach, and even now, I think it's in this generation that many families are starting to embrace as we call them, the fur family.
Yes.
Yeah, and I think it's a step in the right direction. So from where we sit and from where, you know, just speaking for many caregivers, what are some of the breeds, Amy, just when it comes to dogs, and then Dr. I'll come to you when it comes to cats, that a caregiver should look out for, you know, that can provide the emotional support, because not so many caregivers would be able to afford, but probably if they wanted to go that direction, what are some of the breeds?
So I'm one of these people that if I'm looking for a dog to do something very specific like this, in terms of maybe working with children who already, you know, maybe don't communicate very well, to me, the breed would not be important. It would be really about the temperament of the animal and how well the child and the dog bond and connect. But as I said, the physical appearance of the dog might be important because, it would be very hard to convince someone to put a 50-kilo Rottweiler in their house or their flat, especially if they're not familiar with dogs. I actually think that probably many of our local dogs would be well suited for this. I don't know how other people feel about that, but I've had local dogs as well as my pedigree dogs, and I think that they're very smart. They score very high on adaptive learning. They're affectionate. They're very smart dogs, and I think I probably would think about that. If you're going to get, I think I said this, if you are going to get a giant sized dog, you're looking at everything being more expensive. Vet care, medicines like tick and flea medicines, feeding the dog, any kind of surgery the dog would have to have. That will all be more expensive. And if you get certain types of dogs that are very long coated, they would require maintenance grooming by the family or trips to a groomer and washing to be sanitary in a house. And, if they sleep with the child or on the child's lap, that kind of thing. So I think you're probably looking at something with a shorter breed, a less intimidating appearance. And also some of these little dogs that we call Spitz, and I know Dr. will laugh, but his camera's not on. Some of these little white fluffy dogs that we call Spitz are very, very, very noisy dogs. They bark and they bark and they bark. And that would also be very hard, I think, to have in a flat or to have constantly, barking all the time.
Okay. Thank you. I'm about to bring on Daktari, but I've just seen a comment on volume. Are we all experiencing low volume? And thank you for joining us from Meru, a participant from Meru. Is the volume okay to the rest of us? Please type in.
It's good.
Okay. Okay, so please just check on your settings, dear participant from Meru. Okay, so I want to bring in Daktari just to continue from there.
Thank you. Amy talked about the selection of the dog. Now you talked about, it could be any animal, like I said, even a cat, a parrot.
Yeah.
We don't look as much as what pedigree it has come from. Just like I always insist when I say, there's no tribe because nobody chooses to be born, whatever tribe or color. So again, for animals, the best, like Amy said, would be your local breeds. You have some local breeds that are, their temperament is very well balanced. If they are cool, calm, and collected, they can take both spectrum of people who are also very aggressive or hyperactive to people who are just they're just there, nice and cool. The back to selection of the animals, I'm just going to reiterate what Amy has said about selecting local breeds. We do not look at pedigree, Labrador, German Shepherd. I look at an animal as an animal. A breed is secondary. Actually, if you look at what breed brings onto the table is issues. If there's a behavior issue, it is amplified by a pedigree. If there is any physical issue, then it's still amplified because then we don't have the hybrid vigor. We tend to select the crossbred dogs, the local shepherds and such, because then they have short coats, they have smaller or medium bodies, they have, most importantly, their temperament is balanced. They are don't eat as much. They don't get as sick as frequently as pedigree dogs because they have hybrid vigor. And that's what I would go for. Same to cats because you mentioned cats. Now, things also to look out for is because somebody who has autism, for example, could have an underlying allergy to animal fur or skin flakes. And that's another thing that you need to find out from the general practitioner or the referring doctor, and cross-check with a veterinarian who is in charge of these animals, because any animal that is going to be used for assisted therapy must be based on some veterinary clinic or veterinary practitioner who you can call quickly and say, I'm seeing this behavior, or this dog has a lesion on the skin. Is this ringworm that can easily go to this patient? Because probably this patient is on some drugs that will make the immune system compromised in a way. So I always insist, and I would say, if this person is going to have this dog working near people, you must have a vet on call. So the animal that you select must have a solid veterinary background, that is good health. Try and pick the shortcuts and all that, but to attest what Amy was saying, and to from where we stand in this country in terms of this field, in my view, I would see that the best place to start is to get some therapists, because I know they're there who love animals and who have the wherewithal to keep animals in their compounds or in their homes to be family pets. When they stay with these animals, then they know what is expected. This is people who can bridge between the patients they see, they know what is required of them, or what milestone they're supposed to see when they do the therapy over time, extrapolated over time, and then they get to understand this animal. So if this person goes to work with these patients during the day or the weekdays, then on weekends, as they take their dog to the vet or somebody who understands animal behavior, they can pick out the tidbits. Or even more importantly, get a certified trainer like Amy, then they can tell them about the temperament, they can tell them about training, tell them about body language, for example, from humans to dogs or vice versa and such. So a therapist who is working and living in the city of Nairobi and is seeing patients in a hospital setting, maybe in the city center or in the suburbs, goes home to their dog or cat. They understand the basic principle of having a therapy animal and the value of a therapy animal in therapy. They actually know the inside out of working with the patients who need this therapy because of their deficiencies, which is, if it's autism, the spectrum syndrome, then that would be a good place to start. Then this kind of person would have walked to the KSPCA or the TNR and gotten a nice local breed that is solid temperament-wise, has good health because they have background support from their vet, and the person handling this dog and keeping this dog actually understands about what we're talking about today, is helping, because the ultimate goal in our discussions here is to have, we already have the other therapies going on, medical psychotherapy, you can have physiotherapy. Now you want to add in another aspect, that is the animal. So the ultimate goal is to make sure that you get the best for the patients that we have that are suffering from these conditions. Now, if we have that person who is amenable to keeping a pet in their house, it could be a cat. A cat, most of the time, most it will do is lie on your lap and just turn around to be petted, and maybe that's a good place to start. The cat might not do tricks like a dog to reward somebody's intention, some deliberate action that they did, like give a command, and the dog does it. Horses, yeah, to some extent, but the dog is the best in this respect. But a cat, for example, you have a therapist who has a cat that is not afraid of people. We have cats that I have seen in very noisy places, in the airport lounge, in churches, at the bus stop, at the fast food places, in the nyama choma joints. They don't fear people. They are used to staying with people. I've seen cats in kindergartens. There's a dog I see in a school that has more than 1,000 students, and I think all the kids know the dog, and he goes to all of them. So if you can start, so it is not because they're trying to avoid the pitfalls of importing a dog that is worth 800,000 Kenya shillings. And like Amy said, it is what failed in the first world because it is many, many miles away and you didn't see it. Some we have even gone there to evaluate them, then they come to our environment and they can completely not cope. So my starting point would be to use the therapist who you already have working with your patients and see, because I'm sure there's people, and you cannot teach love for animals to human beings. It is inborn. So I'm sure out of 10 therapists you might have or you might encounter in the hospital setups, out of 10, maybe there's 2 people who really like animals, be it a cat or a dog or a horse or a cow or a goat, whatever animal it is. That's a good place to start because you can say, hey, in the suburbs of Nairobi, people are keeping livestock. So they can say, I actually have, my cousin loves chickens. He can talk and stay with a chicken, and he did that since he was a boy. He's 37 years old right now, and he should not hear me. Even a chicken can be a therapy animal. So if you have a therapist who has some connection to some animal, that's a good place to start because then he can be, in fact, he can be your contact person when you get somebody claiming to do therapy with animals, because he will be looking and be seeing this therapist, this handler has come with a dog saying, or a cat saying, or a horse saying he's a animal handler for a therapy animal. He's able to feel and see the communication between that handler and their animal. So in my view, it could be a time-saving step. It could be also an economically viable channel or route to use. That is the way. So another thing Amy attested to is to go to the shelters, which is the Kenya Society for the Protection Against Cruelty to Animals, which is a KSPCA. You have TNR Trust, Trap, Neuter and Release, which she's very aware of. And there's some animals that they rescue and they stay in their shelters for some time and they socialize them. Then the families can organize trips for their children or their young adults or teenagers or people with the neurodevelopmental issues or attachment disorders or any other mental health issues to visit the shelters. Because I know in my previous life, I worked for a company where we had retired bomb detection dogs. And because we select bomb detection dogs from very, very stable lineages, to make sure this dog is not faced by anything and they're not aggressive, they don't have a grain of aggression in them, they are used to being manhandled, they're used to being in people's luggage and smelling and everything. People would come for weekends, and I know there's a family who brought their 2 teenage children to spend time, because that gives them a sense of responsibility. And they said, let them start from the morning, clean for the dogs, feed them, take them for walks, play with them, and then after they finish, they can take their phones and just sit with the dogs. These dogs are spaniels. They're very keen to human company. So if you can have people who have families who have patients and doctors or therapists who have time, they can visit the shelters where you have these dogs already and see how that interaction with animals it's just a good starting place, and it's a good learning curve when you go there and see what happens. But in a way, then also, if you floated that to the caregivers, then you'd see out of 10 or 20 people, 2 people will come forward and say, I'm really interested in this. And that would be a nice place to start, where we can again offer voluntarily our guidance to say, this is what you look out for, and these are the places you can go to. And also now enlighten us a bit about the work you do in treating or assisting and helping the people who have these conditions. I hope that suffices for now.
Yeah. Thank you, Dr. Maybe I could ask some of our caregivers, have you had an opportunity, do you have an animal at home? How has it been with you, with your child, and which animal? Is there any one of us who would like to share with us? What have you observed with your child? Joan?
Good evening.
Good evening.
My name is Stella from Sangida Foundation, Nanyuki. And we have a dog that stays at the home with the children. But this home is actually attached to one child, because that child came with the dog to the home. And now that dog actually has 4 puppies. So how can we train them to what we are talking about, so that we don't need to look for other dogs, because we have now 4 puppies that are there that we can use with these other kids.
Thank you, Stella.
So I'm going to jump in here really quickly and ask, how old are those puppies now?
The puppies are actually 2 weeks.
2 weeks?
Yes.
Okay, so they're little, they're very little, but that gives you adequate time to reach out to KSPCA Nanuki and
Yes.
try to make a date to get vaccinations done with those puppies, and
Yes.
also to get the mom sterilized as soon as the bitch has weaned those puppies, to get her sterilized and make arrangements to get the puppies done later, because if not, you will have, in 6 months, you'll have triple that number of animals to care for.
Yeah, true.
Seriously. So I think if the puppies are born there and the children are allowed to handle them, but only supervised, and certainly not anytime soon. I would wait until like 6 weeks or so. They can see the children, but the children can't, pick them up and handle them unless they're sitting down and it's one child, one adult. The puppies will become quite acclimated to that environment. And then I think that probably most of those puppies, if they've grown up there, I think they'll be just fine. In the US, we have a number of programs where people that are incarcerated for a number of years get to have a dog in their cell with them, and they train the dog. These are people that are being rewarded for good behavior. And so the dogs actually, live in the prisons. And the interesting thing is many of those dogs then will go off and go to work and be contraband detection dogs in other prisons because they've grown up in that environment. So it doesn't bother them to be walking down a hallway where all the prisoners are hanging on the bars and shouting at them or, name calling, making noise. So the puppies grow up in that environment, and then they know how to handle exactly that day-to-day life, whether it's, children or whether it's prisoners.
Okay, thank you. Is that okay for you, Stella, or Doctor? You have something you'd want to add?
Just to top up, for Amy has just said about everything, because that's a very formative stage. When they're 2 weeks old, you have a chance to put them in the right direction. So that everybody is used to dogs, that they learn about dogs. They learn together as they grow. For the mother, she has to be neutered, and if she's used to just one child, that's fine. That is no problem because they're not forcing them. Now the puppies again will not have to be. We don't like to do wholesale. Don't want to have the whole bunch of the litter running around with the whole group of the children. So like we said, is one adult, one child, one puppy at a time, and only start with the puppies that are confident. Don't start with the ones that are a bit timid. Now, when a child sees another child, we don't even have to have contact, direct physical contact with a child with a medical condition like we're speaking about here. If only they see another child getting gratification from having a chance to handle another dog, that's good enough, because they learn and they look. And like we said, you must give them something to get interested in that will in future form a basis for reward for them also. So if you have this puppy, like say Amy said, we start with the medical side. You don't want to start exposing them too early, because they can get viral conditions and they die, and you have other problems and issues. Get them neutered, the mother, then the puppies later, and then we talk about the behavior issues in between. So basics like when the time they're being fed, that you can get from the SPCA in Nanyuki, and they can tell you, write maybe a page or two, and which can be put prominently on notice boards to say, I don't know the name of the mother. I don't know. I'll just call her Queen. So if Queen is to be fed by everybody, or she eats when people are having, or the children are having meals, there must be some form. There must be some habit formed, so that you don't have animals are animals. You want to form a habit with them, so that you don't confuse or mix them up too much. So if they're being fed at a particular time, that should be stuck on by everybody. If they're being spoken to in a particular language, or the commands we give, people should try and adhere to that, which I think in my own way is a way to have also some reward coming from that interaction for the kids, to know if they say sit, Queen will sit down, and the puppies, of course, when they follow. So it's a nice place to start, and it is quite cost effective. It is in the right place because she's into that environment, and the SPCA will take you through, because I'm sure their vet will take you through the initial requirements of that interaction in the light of animal behavior, what you're supposed to do and for the children. And of course, now you attending this seminar, you understand now it's not one size fits all, or it's not just having a herd of cattle that you can say, oh, these animals will make somebody feel better. No, it doesn't work like that. So it is a stepwise, and it takes a very keen eye to notice that click when you get the click from the patient and the animal. Number two, for the person, you are professionals as therapists to see the change or the benefit of that modality of therapy. On top of the other modalities used, the medicines, the sessions you use for your patients. But if you have any specific or particular question, you can feel free, you can go ahead and ask. Thank you.
Okay, thank you. Stella, I can see she's copper. The mother is copper. So I want to come back now to our panelists about maintenance of these animals. I know you've alluded to some of it earlier on, but I want to bring in a situation where I'm in up country and we do not have we are not able to access some of these things that are in a place like Nairobi for maintenance. What should a caregiver do to maintain the cat, the dog, which are the most common in our space right now? So I start with you, Emmy, then I go to Daktari.
Well, unfortunately, I'm going to talk about Daktari's the same thing he's going to say, which is probably the cheapest and the easiest and very important thing to do is deworming, because a lot of times people don't realize that, you know, puppies and dogs are always full of worms. They eat everything that they get the chance to, and kids are usually not very good about washing their hands. They're usually not very good about washing their hands all the time, or they may share the food. So it's important. Deworming is super important, and rabies vaccination. I would hope your government vet would be able to at least give a rabies vaccination.
Yeah, thank you. Thank you for that deworming, Amy. So what about you, Daktari? Over to you.
Okay, I'll have the broad classification of this maintenance for any animal, of course, and of course therapy animals. What Amy has spoken about is husbandry. So when you do deworming vaccination, that is preventive medicine. Some of the conditions that will jump from animals to humans and vice versa are preventable. Rabies being one of them. Some of the types of worms that occur in animals will jump into small kids. Usually the young and the a bit older, the geriatric. But well enough, most of these are preventable, easily preventable using deworming, which you can do every month or every 3 months. And vaccinations that, like she said, a government vet would be able to do the basic, which is rabies vaccination. I also insist you must do for the other conditions that only affect the dog, because you don't only think about the zoonotic conditions that can affect the humans also. Another aspect of well, this care for the primary care for the animal in the husbandry aspect is important, because this pet or this animal that is going to encounter something in hospital in a home setting should not go and add to their problems. You know, like a physical condition like ringworm, like worms, like cryptosporidiosis, which comes from feces and such. So they must be clean. They must be kept in a clean place. Talking of which, the environmental health is very important, and sanitation, where these animals stay, be it in somebody's house, in a kennel situation, be it a stable if it's a horse or a cat. For example, if you have a cat that it's always, cats are very notorious for walking on tabletops, sitting with people when they're eating, where you like to watch television, they're always with you. If you do not have a cat, and you know what cats do with their poop, they're very, very, very keen on burying their waste, which is a natural instinct. It's instinctive, like dogs. So anytime they go and they don't have a proper litter area or a litter box provided, they'll do it in shallow soil or in the soil. Like now it is raining outside, they will not even do it. So, and if sometimes they do it and they step, there's such a close contact with their excrement. So that's a very easy way of getting this contamination through. So if you provide for cats that are going to do therapy and go to be petted or to come into the proximity of your patients, then they must be provided with a proper litter box. And for this, we always recommend you have a litter that is, there's some commercial litter that has a bit of disinfectant and a bit of a perfume, and they don't stick. So anything that goes into the litter remains there, doesn't stick to the cat's paws. Now, you might have to go to the extra effort of wiping down with wet wipes the cat's paws when they're going to interact, because they'll be playing with these kids, they'll be handled by these adults and such. environmental sanitation, how you get rid of their waste, how you get rid of, how do I put it, cleaning up their living spaces, because you're minimizing the load of germs, viruses, and bacteria where they're living, so that when they come out of there, they don't have even as simple as washing the car in which they ride to go to these therapy centers, making sure it is washed at least once a day with a particular disinfectant and such. Now that is maintenance, and husbandry will include that is health. Then we've talked about hygiene, and then food, how they're fed. That will depend. If you have a dog that is staying with you, for example, you say it's Stella in your center, this dog might be eating rice and mincemeat from your kitchen, which is okay. If other dogs have to stay and be in an urban center, they have to keep hopping between health centers, they might have to be given commercial food, which is much easier to feed. And all you do is give the dry kibble, which is like pellets, and just give water. Beyond the husbandry, we have also, if they have to be up to par to their task, somebody has to accredit them, somebody has to inspect when they are working. So in comes the issue of primary certification, training and certification, that somebody has seen that this dog, especially, we keep talking about dogs because it'd be the most popular in this sense, that they get their primary training, they're certified against some set objective criteria, and there's continuation training, because a dog can start from a setting where it's only children of a certain age who he's being exposed to, but then graduating to going to meeting up with adults who are a bit more interactive, and they probably don't have autism, because you do not separate these therapy dogs and say, until I get autism. You can find they are very good sorting other issues, and they graduate or they shift their specialty to other places. So the continuation training and assessments are very important. Now, veterinary care, again, is a huge topic on its own. We're saying, even if you've done the primary preventive medicine, if somebody notices something funny on that animal, ringworm is usually one of the most insidious, one of the most common condition that you even as veterinarians get. And we never ask, as we know, we got it from a cat. It's usually, cats are usually the primary culprit. But we know if you have ringworm, you must have gotten it. Sometimes it even helps you get a diagnosis for a dog that has had issues with the skin and you've never even gotten it from the lab. And then you're like, I got ringworm. This must be from a particular dog. So the veterinary care must be on point. You must have a veterinarian who is on call. So you are setting off in the morning and you notice the dog has a bit of diarrhea or has persistent diarrhea. The dog is fine, eating well and everything. And lo and behold, this dog could be having cryptosporidiosis. Some of the people who suffer mental issues would be stressed, would have low immunity, they're on some medication. You don't want them contracting cryptosporidiosis or indeed ringworm. So I only wanted to add on to that aspect. And yeah, and all of them are costly. So we're just trying to get a midpoint where if somebody can be able to have a dog or a cat as a therapist, which they can put in their car and drive to work with them, that will go a long way in alleviating, because some of these costs will come in training, maintenance, which is medical and food and veterinary care. If you have to transport a dog to a healthcare, you'll need a specialized car or at least a car, because you can't transport this dog on a motorbike, for example, or a bike, or walk long distances. The dog will be tired by the time they get to work. Or when he's going to interact with this patient, the dog is so tired, they just drink water and they go on their side and sleep. Well, we want a part of this therapy to include those moments of just calmness. Sometimes just watching a dog sleep or a cat sleep when they have no care in the world, they don't even know where the next meal is going to come from, but they sleep so soundly. And knowing that they may be sleeping on a floor next to your feet, they are not worried you might step on them. They're not worried the shilling might be sliding deeper from the dollar tomorrow. They are not even in tune with where the food comes from. Somebody watching an animal like that has some benefit which is not even tangible. So, but you don't want a dog to go to work and sleep the whole time. At least you have some sessions where they can interact, take a short walk, give a few commands. Then by the second half of the hour or 2 hours, the dog is acclimatized, is sleeping, and the person can benefit from that interaction. when that pet has let go, because that's another thing very important in animal assisted therapy, to notice and to wallow in that space of peace and balance, you know. So if you put into consideration all these things, they come at a cost, and in the best ways to mitigate these costs is some of the practical ways having the therapists have the animals come to them, or take your patients to an animal shelter, where you can get benefit. Sometimes you might get or not get the benefit, but you might be lucky enough to get an animal or two, or one patient who, because even if we help one patient, one person, that counts. That's no longer statistics. So that's all I would say about the maintenance for these animals for now.
Okay, thank you, Daktari. I have a question on animal shelter. Do we have that like in every county in Kenya? How readily available, Daktari, are animal shelters?
Amy would answer that better, but let me just give an introduction. We have the SPCA has been the longest operating animal shelter in Kenya, and also it is in the CAP 360. We have it's enshrined in the constitution and the laws of Kenya, so they have the mandate, so they have a bigger spread. But all said and done, we have now other shelters and charities that deal with the pets, because it's a huge, almost infinite problem we have with stray animals and mistreated animals, even if they're not stray and all that. So organizations like TNR have come in to bolster and to help. And these two organizations, I'll speak freely because some of them come from abroad and interact or do joint ventures with the existing shelters here. For time bound for some time, then they go back. But we have the SPC and the TNR who've been around for quite some time. And the beauty about those two organizations that I'm just talking about is because they have professionals. They have professionals in their board of management. They have professionals in their clinics, in their kennels, who are not just doing it for the sake of charity. You know, charity comes in many ways and for many reasons. So those two, and I don't want to talk too much about this, and Amy will give a bigger insight. She'll tell you about where they are available and they are spread in the country, because at least I know they have quite a footprint in the country.
Okay, thank you. Amy, over to you on the shelters.
So KSPCA has set up branches now. I mean, the biggest one is in Nairobi. At any given time, there's over 200 dogs there. They're frequently full where they can't accept any more. They have branches in Mombasa, branches in KSPCA, branches in Naivasha. I think that's the main locations, but that would be the place that I would start out with looking for a dog. If you call one of their adoption coordinators and talk about, what you want the animal for, the dog or the cat, then they can help connect you with an animal that might be suitable for this kind of therapy. The other thing is you would have to sign a contract that has some basic welfare tenets for the animal, like you can't leave your dog out on a chain or locked in a box. You have to provide vet care and food and water. They're all basic things, but they want to make sure if you're adopting an animal that you will care for it, and you're not allowed to breed with those animals. So you also agree that the animal has to be sterilized, and usually you can bring it back to that branch. Or for example, if you adopted it in Nairobi and you moved to Mombasa, you could probably have the sterilization surgery done at another KSPCA if you organized with them.
Okay. And for some people, KSPCA could be the first time we're interacting with that. What is it in full?
Sorry, what is it?
KSPCA in full. What is the full term for that?
So it's for the protection and care of animals. So
Okay.
they take dogs, cats, horses, donkeys, sometimes other meat animals that have, like they took those cows that were used in a demonstration in town where they were painted, and the donkeys. So they have a number of animals, so it wouldn't be limited just to dogs and cats, but I think the easiest way to get started would be for dogs or cats.
Okay, thank you for that. I'm taking in a question, the first one that came in. Can an ordinary dog be trained for therapy? That's by Lillian. Then then once we've answered that, Ann Nyambura has raised her hand. She will ask the question. So can an ordinary dog be trained for therapy?
So the answer is yes, if the dog has the right temperament. There's a lady in Karen who has had Labradors for many, many years, and she is a human physiotherapist. She's retired now, but she would sometimes take one of her Labradors into an old folks home where the person was shut down. They wouldn't talk to anyone. They wouldn't do any of their activities or exercises. And she would just give the dog a bath and a good brushing and take it in. And she would not talk to the person or make them do anything, but she would start brushing the dog. And then, you might find the senior citizen then, coming over and wanting to interact with the dog. And if she handed the brush to the person, then they might try to do some brushing. So if the dog has the right temperament, then yes, but I wouldn't say absolutely any dog could be a therapy dog.
I wanted to see my spoon.
1, 2, pick.
Daddy, Melody.
So, okay. Kindly mute. Thank you. So any dog can be trained.
No, they need to have the right temperament. I mean, because you can't, if a dog is very frightened and nervous, you can't train that out of a dog. I mean, it's their innate personality. For example, if I were a very shy, introverted person, it would be very hard for someone to train me to be the life of the party, to be very outgoing. So it's the dog's innate nature, and also lack of socialization in some cases, and what they've been exposed to. So, for example, if you took a dog who had been mistreated by children, it would probably be very difficult to make them a suitable dog to work with children of that same age group. So really, the temperament has to be there before you can do it, but it's not impossible. Depends on the dog.
Okay, thank you for that. So Anne, you can ask your question. Please go ahead.
All right, thank you. Sorry, I was a bit late to the meeting. I saw the poster in the WhatsApp group quite late. So my question was, one, we already have two dogs actually, a mother and a daughter, and we've had the mother is called Betsy. We've had her since she was, I think, 6 or 8 weeks.
Nice.
She's now close to 2.5 years. And then the daughter is about, she's not yet 1. So which would you suggest for the training one? Is it the daughter or the mother? The mother is really good with us, with the family. My son already plays with Betsy. So the other question I wanted to ask is, what does the training entail, so that we can know which would be the best dog to do training for them to be a therapy-assisted dog for our son? And then where is that training available, and how much does it cost for such a training?
Thank you.
Probably as a guess, the older dog would be more suitable right now, because a 1-year-old dog is generally, unless it's a toy breed, a 1-year-old dog is a teenager. So their brain is still developing. Basic training that they may have had, is sometimes in their brain and sometimes it's not. So probably the older dog. There's no such training in this country. So you would need to be very careful that you don't fall prey to some of these quacks who claim that they can train your pet dog to do everything. That same dog can become a service dog and an EDD, an assisted therapy dog, and they could do narcotics detection, and they can climb up a tree and all kinds of crazy stuff. So
Yeah.
if you're using your dog for therapy, there wouldn't be at this moment any place you could take your dog, but you would want to do very basic training with the dog. And then I think it would depend on the child. I'm not at all versed in teaching autistic children or children generally, other than what I encounter in daily dog training with families. But is there any particular thing that you would want with your child that needs help?
Not really, just generally playing, because number one, he's autistic, but he's also an only child. So sometimes he wants to play, and I am not really, being an adult, it's not all the time you're keen to play as much as your child wants you to run around with him. So they do already do that with the dog. I would tell them he would do fetch with the dog. So I have not researched or looked into it much about what the capabilities of a dog, helping with an autistic child, but they already do play together. So I was wondering, is there more that can be done?
So I'm sure there is more that can be done. As I said, this is not my background in terms of working with autistic children.
Okay.
That I would think the dog would just need basic training, as in good manners, like don't jump and don't put teeth on the skin. Like if your son is tugging or taking the toy, that if the dog's teeth are on the child's skin, that the game just stops. I think it's probably just basic manners. I mean,
I
please
agree with you. Because like when they play fetch, he's really good with fetching, but he has difficulty in letting go of the frisbees or the ball.
Right. So that would just be a basic cue, like drop. So those kind of training wouldn't be very difficult. You just need to be really careful. I'm laughing. Steve will laugh about this too. I saw somebody posting on Facebook. They taught their dog to go and pick up a remote control, like for the television, and bring it back to them. And then they were claiming now that they train service dogs. They're a service dog trainer. I mean, that's no different than teaching your dog to fetch the ball and bring it back.
Yeah.
So I think just basic manners. Are you based in Nairobi?
Yes, I'm based in Nairobi. We've like exactly what you were saying. We've lost money from people claiming that they teach obedience and this and that, and then they show up for 2 classes, and then the consistency is not there. So we just took up the role ourselves, watching clips on YouTube to teach our dogs obedience and just generally how to play and just live with the dogs well. So for the big dog, I feel like we've done a good enough job. We're not experts. We can, just give, simple commands. So I've been trying to teach fetch, so it can fetch, but my husband can tell it to drop the ball, but me, for some reason, it's a struggle sometimes. But yes, so we are in Nairobi.
Okay. Well, just quickly, if you are free on Wednesdays, they do have training at the East Africa Kennel Club. They've just moved back to the regular grounds, which is on, I think it's called Kibera Drive, but it's on the way to Showgrounds.
Yes. We actually took Betsy for that obedience training for German Shepherds back when she was 1 year old.
Okay.
Yeah, so we wanted actually another one for this younger one. She's called Leah, but they didn't have any at the time. So I'll check because we're also members.
But if you join the Labrador Club, and you can have any kind of dog, and if you get there on a Wednesday, you'll see that the majority are not Labradors. It's everything. If you join the Labrador Club, You can come on Wednesday mornings, and basically your training fee is included in the membership. So you can come every year. I mean, sorry, every Wednesday that they have training, which is no public holidays and no. I think they take a month off between Christmas and New Year's. But other than that, it's very good socialization and training, and I think it would be a very inexpensive way to just get some basic things. And I shouldn't say it, but I will. I find the German Shepherd training is a bit old school and outdated, and it really is more concentrated on obedience, which is fine if you actually intend to do an obedience competition. But for dogs that just need good manners around the house, then I would start with the Labrador Club on a Wednesday.
Thank you for the tip. I will go
You're
there
welcome.
and check it out on Wednesday.
Great. Just bring your vaccination card because they'll want to see that your dog has been vaccinated.
Oh, yeah. We're up to date.
Yeah, great.
Thank you.
Thank you.
Just
Thank you
to
for
add,
that. Very.
sorry, I can add maybe 2 or 3 things. At least I see you have a bit of a background on the training and on in the context of having an autistic child. This is quite good because basic training will let you have some bit of control over your dog, where you can give commands, they can come back to you and you do a recall, they can drop a ball and such. So that is good enough, and you're already some distance into it for the older Betsy.
Yes.
Now you might want to add there's the I don't know what they call them. There's these sticks they use to throw the ball so the ball can go a bit further.
It's a chuck it.
Yeah, there's something they call it.
Oh,
so
yeah, I also have the gun for the ball, which
Perfect.
can throw the ball a bit further. Yes, I do.
So that so small bits when the dog comes back, maybe your son will be having something else to exchange the ball with to make it easier for him, because we are looking at his welfare and his development. So if he's getting frustrated by the dog not dropping the toy, he may as well not like that. So if you have Amy will tell you about these bits to help a dog drop. Now you have also some tricks you can do with the dog that are very fulfilling and gratifying. Basic tricks, I've seen dogs, even if they're not keen to using their noses too much, most dogs will want to use their nose. I'm sure he's so attached to your son, so if he uses his socks, the socks that he's always wearing, fold that into a ball and hide it somewhere, even under a carpet, not a long distance. The dog will go around. When they find it, it's very, very, very how do I put it, fulfilling for the dog and the handler. The handler in this case will be your son, and you can see that. So another thing is putting treats. You can hide it in one hand, switch it between the 2 hands and see which hand. If the dog finds it and they sit, boom. So small things like those will be taught by the trainers. And like we said, you'd rather stick with Betsy because Betsy is already into it. The daughter is still a teenager, so that will take a bit of time. But you become, so in the context of therapy, you have the patient who is your son, and there's very good interaction there. The therapists in this case would be you and your husband, because that's your only child. And the environment is your house. So if you go to a new environment like the Kennel Club, that will be the new environment, which would also put in some level of advancement or difficulty for your son to go to the next level to see if this what you do at home can happen out there. Then the trainers, of course, will teach you the right way to do these things. And dogs, I'm sure you have very high energy dogs, which hopefully, and I know it rubs off on your son, and that is good to hear. And we'd like to hear about this development. And we wish you all the best. Yes.
Thank you so much. Really good tips. I will follow up. I'll go to the East African Kennel Club to see when I can start on Wednesdays with the Labrador group.
Perfect.
Yeah.
Oh, thank you. Thank you so much, Anne. I believe we're all learning, and that was quite insightful. Thank you for that. Before we close this session, any other question from any of us? Okay. Now I see our time is so much spent, so we'll start wrapping this up. And in a nutshell, there are a few myths and misconceptions in Kenya, but even before I come to the myths, when we were talking, I was just thinking about what I was seeing when growing up. And I could see at some point, Dr. mentioned getting litter. So I think the alternative for the litter in the village was you go to a timber yard and the chippings. And I'm just trying to relate with that person who's somewhere. Does that work? Because you
Yes,
get
yes.
chippings and
If you go to the pet shops today, you'll see some very expensive sawdust because they say it's natural, it's organic. It doesn't have the clumping factors that you have with the hygroscopic salts they use. You have the wood chippings that are scented a bit and they're sold for a premium. So sawdust, if you don't have sand or litter that you can buy from a shop, sawdust just works as well. It's only that it's a bit messy because the cat will track it when it comes out of the litter box. But any deco sawdust, you also use sawdust for composting toilets, which works very well. So yes, absolutely, 100% you can use sawdust.
okay. Yeah, okay. Because I'm thinking about that caregiver in the village. What are the alternatives? Yeah. Okay. So I want to come to myths and misconceptions when handling, animals or, in animal-assisted therapy. And as you can see, we have limited awareness on this. So I'm really grateful that you have, both of you have come through to enlighten us. So maybe starting with you, Amy, maybe 2 or 3 misconceptions, myths and misconceptions on animal-assisted therapy, then I'll come to Daktari.
So I don't know enough about animal-assisted therapy to actually give you any myths on that, but some interesting things that are coming out, dog training, whether you're training for detection dogs or whether you're training therapy dogs or pet dogs, so much new science comes out that, I literally could spend 24 hours a day reading and studying. It's very hard to figure out what I want to study next. I always have a list on my bulletin board about, what's the next thing that I want to see something new on. But the biggest change since the 50s, since the 1950s, is the fact that positive reinforcement is what gets you further in training your animals. If you use this, I'm the boss. If you're rough with your dogs, if you use aversive equipment like, shock collars and things like that, your dog may fear you, but they won't actually want to learn anything. So positive reinforcement works when you're teaching humans, whether it's an autistic child or a child in the classroom or your spouse. So positive training is the way to go. So you don't really want to go back to these old methods, where they were doing horrible things to dogs to make them learn. So I think that's probably one thing that new people fall for. You'll get a trainer that tells them they have to be the boss and you have to be the pack leader. It's not correct. It's been disproven. If you Google it, you'll find about 3 million hits. And it's something that is very important, because you get your dog to want to learn things because you have a bond, a connection, you love your dog, and you take care of it, and they take care of you.
Okay. Thank you for that. While we are at it, maybe you can give us our parting shot, Amy, then we'll go to Daktari.
I think that many dogs actually can do this work, even if we don't call it work. I think many dogs already do this work and we don't realize it, in terms of they're in our homes. If we've had a bad day, we come home and, our cat sits in our lap, or the dog comes to be petted, or the dog wants to go for a walk or play ball. So I think actually we don't have all these fancy designations in Kenya, but I think many of our pets are actually doing this work already. I know my dogs do.
Okay. Thank you. Actually, it's true. It's true. I think they already are. It's just that we didn't have a name for that. We didn't know they're actually doing it until probably it's brought to us to know that the pets that we have at home is actually doing some, it's actually assisting some form of therapy. unknown to us. That's true. That's true. Thank you so much, Amy. I want to bring in Daktari to also give us an insight, a myth and misconception, and then a parting shot.
On the misconception and myths, I know in my practice or interactions as a community that people thought if you had animals in your household and disease was being distributed or was coming by your homestead, it would go into the animals first. And that's why people, particular ones kept animals. So the animals or the dogs got sick first. That is a huge, huge misconception. The other myth is because I know they would refuse for us to put down their shepherds quietly. So until we are told in the religion, I could be wrong, so no quote on this, that they believed that the animals are getting sick instead of them. So if you put down the animal, that sickness will jump into the members of the household. That is not true. And I believe all of us are beyond that. We either believe in the Almighty or we believe in science. Now, the other myth would be, unlike the days when people used to take animals to the traditional healers or witch doctors, you're told to take a chicken, a black one, a white one. This is not what animal assisted therapy is about. This is not about going to take anything or to take any balance from these people to these animals. This is based on science. It is solid science. Where is people? I know when people have even most learned people who have gotten a decent education and everything, when they land into problems, they also visit witch doctors and start to believe something absurd or something out of this world or not based on science. But animal assisted or having animals in your presence is good and is based on science. It's good for therapy, and the basis is entirely 100% scientific, not anything outside of that. I know it has many names, whatever it is, but it is science. It is science. It is science. I've seen also myths where religions will forbid their members not to interact with some particular species, like Muslims and dogs. It's in the Quran. It's true. We have vets who are Muslims, and they have told me, as long as you clean up, wash your hands, and don't come into contact with the fluids and the whatever of the dog, you can. So, but to circumvent this restriction, then you can use horses for your Muslim patients, or cats. They really like cats. So that's another thing. My party shot would be that we are seeing an ever increasing interaction or acceptance, the embracing of animals in today's modern society, African setting. People will never keep dogs, especially from my background, where I come from. They will never see our dog homestead, but that is changing because of urbanization and civilization. And that is why you are seeing the ever increasing importance of animals in the society, be it diabetes detection dogs, be it emotional support dogs. We have dogs that protect us from harm, that detect for you the bombs at the airports and everything. And now in our context, we have dogs that will help in treatment. When you're using chemotherapeutics, when you're using sessions in physiotherapy, physical therapy and psychotherapy and such, then you have the animal assisted therapy. So all I'm saying is that people should be aware of these channels and change mindsets and embrace. It's only that us, the experts or people who are in this part of the world, should look for the best possible way to make these modalities available without cutting corners. Like Amy said, get trainers and breeders will say, my dog can climb a tree, it can plant a tree, it can sniff for drugs, it can do therapy. So we are trying to do this, but do it the right way. And we have no choice, because this is becoming an important part. Animals are becoming pets, important part of our society, modern society today. Thank you.
Thank you. Thank you very much, our panelists. Thank you, Dr. Stephen. Thank you, Amy. We are so, so grateful for your time, for your insights, and just taking us through this topic. Thank you so much. As I said earlier, this is a relatively new topic for many of us, many caregivers. And so I believe this has helped shed light. I just want to put in a thing or two to our caregivers. Remember that animal-assisted therapy is not the only, it works alongside the other therapies, speech therapy, occupational therapy. So it's not a standalone. It also encompasses the rest of the therapies. So it's one thing that you can just add on. And as Amy said earlier, just to reiterate, there should be supervision when you're working with an animal. So, it's an animal at the end of the day. So let there be supervision and the child is interacting with the animal just to make sure that your child is safe and to avoid any accidents. If there is any question, this is the time to raise it as we bring this to a close. But any question in just maybe a second or two? Okay, so I believe that we are all contented with the information we have received. Thank you so much. Maybe where can people find you? Probably you could tell us and maybe type in also on the chat so that if somebody wants to look out for you, where can they get both of you?
I'll just put some contacts here on the group.
Okay. Yeah, please check out for the contacts. If you want to reach out to Amy and to Daktari on the chat section, you will find them. Yes, so for Dr. Steve, it's there 0759 347 404, and he's located in Hardy, Karen. So the number once more, just 0759 347 404. Thank you for that, Daktari. Then for Amy, it's coming right up as well. So that that is Emirap 0733 255 406. The custom-made canine@gmail.com, that's the email address. Once again, the telephone number 0733 255 406. So we're bringing this to a wrap, and to all our participants, thank you so much for your time. Those who will watch later, thank you for creating the time in advance. If you have any question, reach out to us, comment, and let us know what you have learned. Also, let us know, reach out to us, Gifted Gems, and let us know what topics as caregivers interest you, and we'll be sure to, and especially on matters autism, we'll be sure to help you. As we always say, we are in it together. If you do not have a support group, we have a support group for caregivers of children on the spectrum. Do not walk alone. It's not an easy journey. You can join us. It's called In It Together. You can go to our website. That is www.giftedgems.org, and you'll find a link that will get you there. Or you can just drop us a WhatsApp. Let me just type that. Or you can drop us a WhatsApp on 0740 697373, and we will send you the link. You'll be right there. Please do not walk alone. You can also visit our social media pages on Facebook, we are Gifted Gems, Twitter, we are Gifted_Gems, LinkedIn, we are Gifted Gems, Instagram, we are Gifted Gems 9, YouTube, we have many more resources on autism. So you can visit our social media pages to learn so much more about the different aspects of autism. Just to mention what we've done in the past, the signs and symptoms, we've also done part of therapies, speech therapy. We've done under speech, we've also done argumentative and alternative communication. And all this is all embraced under autism. We have also done occupational therapy, just for you to know what these therapies are and how to go about it. You'll find so much more in our YouTube page, on our YouTube page, that is Gifted Gems. So once again, thank you for joining us. This month we are doing ABA. So be sure to join us on our social media pages, and we'll see you around. God bless you, and God do you good. So we will close with a word of prayer as we open with a word of prayer. And so let us pray. Lord, we thank you for this beautiful evening, and thank you for allowing us to to have this webinar successfully. And we pray that whatever we have learned, it will help us as caregivers, even embrace the animals in animal-assisted therapy in our homesteads, dear Father. So bless the panelists and all the participants who are watching now with us, and those who will be with us. In Jesus' name we pray. Amen. All right, God bless you. Thank you for joining us.